Hey, good morning here, West Salem. I'd just like to introduce myself. My name is Ryan Rieber. I'm the superintendent of schools here in West Salem, and obviously we're in an interesting time right now, and a time that we've never been in before. And to help to give everybody some information on this, I've asked my two right-hand ladies here to go through and share some of the things that we're doing within our school district to help our staff and students and our community with COVID. So at this time, we'll do some brief introductions. So I'll throw it to Rose right now, our school doctor.
Hi, my name is Rose Wolbrink. I'm a family physician for Gunderson, and I've been the medical advisor in West Salem for several years. This is the first year that it's been maybe as busy of work. I touched base with Beth and Ryan for sure most weeks on WebEx or Zoom like this as well. But we talk a lot and are trying to do our best to keep everybody safe and education a priority.
Hi, my name is Beth Clements. I'm a registered nurse, district nurse for West Salem School District. I've had the pleasure of serving your families and your students and our staff for the past 5 years. As Dr. Rose had talked about, I'm continuously talking to our community partners at the county, at the different health systems, and also other school nurses in other districts to be able to keep on top of everything that's going on COVID related.
And I just want to share a huge thank you to both Rose and Beth for the amount of work that they've done and how they've helped us with this. You know, never before have we felt like within a school system that we would be in a point where we're watching health issues so closely. And so far, that's all this year has been. Thankfully, we've been in school for over 5 weeks, and we spent the month of October within our building, which is a huge celebration because no one else around here has been able to do that. And a lot of that is to the help and guidance of both Beth and Rose to help us get through there. And we'll talk about some of those things here as we continue on briefly here this morning. But what I just wanted to do is share a little bit of information right now of our decision making and how all of the decision of whether we're going to be face-to-face and our schools are going to be open or whether we're going to be virtual and how some of those things come apart. We're continuing to follow our municipality numbers here in West Salem. And we're using a combination of both the Harvard and the Minnesota model for education within these COVID times as guiding lights to help us decide where things are going to be. And we do have that cutoff line of 35, where if cases within our municipality are above that 35 per 100,000, then we're going to be going virtual. If it's lower than that 35, then we're going to be doing our hybrid face-to-face type models, which we were doing back in October and for that week here in September. Now, recently what we're doing is we're looking at, we're using a reference from the Cooley Collaborative site on a weekly basis and looking at those municipality numbers. Now, if you've gone to that Cooley Collaborative site recently and you look at the West Salem municipality, you can see that those numbers are quite large. And then weekly, when I report out to you, that number that gets reported out is quite a bit smaller than that number that's on the Cooley Collaborative site. And I just want to take some time here to explain why that is. What goes on a weekly basis when anyone goes in and gets tested for COVID, if they end up being positive and if they live in West Salem, it doesn't have to be the village of West Salem, but they live in Hamilton, if they live in Barry, they live in Greenfield, live in Medary, wherever you may live, if you test positive and you come to school in West Salem or you have that West Salem address, that positive case count gets tied to the village of West Salem. So when you look at that village of West Salem number is drastically larger than what it really is. And so what we've worked on here in the district office is we've been in contact with the Census Bureau and we've found the true population for the school district of West Salem. And so we use that number that gets reported out on a weekly basis on that Cooley Collaborative site. And then we do the math, and in conjunction with our census population, that's how we arrive at the number that gets reported out to determine whether or not we will be our mode of learning, whether it be hybrid, whether it be face-to-face for everybody, or whether it be virtual like we currently are right now. So just so you know that when you look at that, when you look at our Cooley Collaborative site on a weekly basis and you see that large number, and then Ryan reports out a number that's much smaller than that on a Wednesday or Thursday, whenever we're able to do that, just know there's some math behind that. We're getting the true count of what our school district population is in our census. So, I know there may have been some confusion with that, and we just want to dispel that right now. And it's not Ryan doctoring any numbers or anything like that in my office on a Wednesday afternoon, but there's math behind it, and we're using that number that gets reported out. I don't know, Rose or Beth, do you have anything that you want to add to that?
I do, and I think people can recognize that because if they've been watching that Cooley website or the Cooley Collaborative County website, they'll see that the West Salem number is always high and red, and the surrounding communities outside of Onalaska and La Crosse, the ones directly surrounding West Salem, have 0 written by them. And that's because those numbers, those cases are being attributed to a West Salem address. And that's why we started questioning.
Yeah, that's an excellent point. So,
Yeah.
all summer long, as we've been looking at that, we've noticed that Hamilton and Barry haven't had any cases. And then after doing digging and investigation, wanting to make sure that we have our kids in school as much as possible, we started asking questions. And I think that's the good thing about this time, is when you see things and you don't quite understand them, the importance of making sure that we ask questions. And that's why we wanted to take some time with all of you today.
Yeah, speaking of that, can I talk a little bit more specifically about some of our data numbers?
Yes.
So we talk a lot about case numbers, and that is important, but I want to take it another step. And before I do that, initially we saw a big case range of college students. That population 18 to 24 was very high. Now it's not. If you look back on the Cooley Collaborative website, you can toggle the switch up top to show just our current date. And so if you pull in the last 2 weeks, you can see that college age group is right around 20% of our cases. Anybody over 80 is only 2 or 3%, which is great, which that leaves about 70% of our cases are between the age of 25 and 80. And so they're also getting sicker right now. And I think there's a multiple factors there, but I pulled in some graphs that I'm hoping we can share with everybody. And the first one says positive cases per day in Wisconsin. And if that can be shared, we now see that it's really trending up. It's not going in the right direction. However, if we take that a step further, we can say hospitalized patients in Wisconsin. And so I share a graph here that really shows a steep trend up, and that's all of Wisconsin. COVID patients hospitalized. That information came from the Wisconsin Hospital Association website, and we can find that online. The second graph is the Western Wisconsin region, COVID patients hospitalized. Again, it's really going up in the last several weeks, and that's probably the most concerning for me. You can take it one more step and look at deaths related to COVID, and this is in Wisconsin. And if we could share that graph, you can see that that's really trending up here in October, mid-October, and now in November. We're starting to see more deaths. And unfortunately, we are starting to get to concerning levels for our hospital staff and our hospital access. Now, let me tell you a little bit about what that looks like. When we admit people here at Gunderson or at Mayo in La Crosse, we're thankful to have 2 big systems right in town. The average hospital stay a few days. Now with COVID patients, they're staying a lot longer. Some of them are very sick, some of them aren't, but they need a hospital bed. And that ties up those hospital beds. It ties up that staffing that would otherwise be there to take care of other illnesses. So much so that today and tomorrow, Gunderson has halted non-essential surgeries. So let me tell you what that means is, every day, Gunderson and Mayo do a tremendous amount of surgeries. And at this time, anybody who would need to be hospitalized for a surgery that's not essential is being canceled at Gunderson. I hear that Mayo is not too far down the road as well, and places all over the state are doing this. And what that means is if you have a hip replacement that's due, or say your gallbladder's been acting up, it's not essential, it's not really infected, but it needs to come out, those might be canceled. And when that starts happening, we get pretty concerned. Sick people get sicker when that stuff happens. And None of us want to see that. Locally here, I talked to several other physicians. I'm an outpatient family physician. And so I reached out to some of my hospital colleagues. One of our intensive care doctors who works in the ICU, he's actually in our district and has a child in our district. He said that the ventilated patients in the ICU have ballooned. We have a large number of them. The critical patients have ballooned. Gunderson opened another floor 2 weeks ago that allowed us to take care of up to 44 COVID patients at once. That's a lot. And when I talk further, we're getting transfers from all over the state, oftentimes in the northern part of the state. And so I was on a Zoom meeting Friday with something we call the Wisconsin Hospital Association Rural Physician Collaborative. So that's when some of us physicians, and I'm one of the Gunderson representatives, get together and talk about what's going on in our community. COVID is always one of the topics. And it's pretty much physicians outside of Madison and Milwaukee, so more rural hospitals. And people are overwhelmed. Testing is not keeping up. Hospital beds are getting full and staying full because it's hard to transfer patients out once they're COVID positive and pretty sick or needing oxygen. And they're being transferred all over. So some of these hospitals have 1, maybe 2 ventilators. I talked to one of the physicians from Boscoville, some of them from Black River. We hear from Duluth and Stevens Point. Those patients are sometimes being transferred here by helicopter. One of our emergency room nurses said that there has been situations where helicopters are hovering over the hospital here to transfer COVID patients. That's a bad feeling, especially when your beds are filling up. And so we're optimistic that we can help take care of this, but we really need everybody to do what they can in order to help prevent the spread. I think I want to talk to Beth a little bit about what you guys are doing in the school, and then I'll kind of come back to what we can do in the community to make this outcome the best we can.
Thank you. That's all very helpful information and leads well into what I will discuss as well about, really just sharing with what our mitigation strategies have been, what we've been using in the school, and then also everyday preventative actions as well that we can be using in our community and at home. The School District of Salem is working to help keep our students, staff, and our school community safe from the threat of COVID. While we have had students and staff affected by COVID-19, there have not been any infections sourced from our school buildings. Each case has had a known close contact or from community spread. The key mitigation strategies that we're using at school, and of course, even the everyday preventative actions that you can use at home, are scientifically proven, evidence-based public health measures that have been around for many, many years. They have been studied, and we know that these things do work. This is evidence that we have been in-person instruction for 5 weeks, like Superintendent Rieber had mentioned. And right now, what we're seeing in our community is our plea to you to help us try to get back into our schools. Things that we're doing at school: health screening of our students and staff. Parents have been provided in each of our newsletters a form that looks like this. You can find it in each of the newsletters, whichever building your student goes to. There is a link. It's called Should I Send My Student to School?, found on our District Health Services website, and then in each building newsletter. We're asking our parents, and it has been a big ask, to keep your students at home when they're ill. And that also means that their siblings stay at home as well. And I know that that has been a burden on our families, but it has helped. In the past, the school nurse has always been very good at saying, let's use some grit and stay in school. But this is a time that even with we're finding that even very mild symptoms like sniffles or allergy-like symptoms can be associated. We see the positive cases of COVID coming from that. We ask that our families follow isolation and quarantine guidelines that are provided to you by La Crosse County Public Health or the school nurses here in our district. Social distancing and cohorting of students and staff. We're requiring face coverings wearing by all students, staff, and visitors. We have enhanced cleaning and disinfecting protocols and wiping down of frequently touched surfaces. And then frequent hand hygiene is offered throughout the day. Our water fountains have been shut off, and bottle fillers, non-contact bottle fillers, are available. Safety signage is found throughout the building. And district ventilation systems provide a level of filtration possible to increase the outside air intake. Those are all strategies that have been utilized in our school district, and they have been working. But now we must continue to take personal responsibility to protect ourselves and our loved ones. And because even though not all of us risk a severe case of the virus, we all risk getting the virus and spreading it to others, maybe without realizing we're sick. If we want to get back to school and back to overall health, we need to follow our state and local guidelines. As our school district, we've been following the Wisconsin Department of Health Services and La Crosse County Collaborative. As always, we ask our family and our school community to wear a mask, keep a 6-foot distance when outside with others outside of your household, indoors or outside. Wash your hands frequently and avoid touching your face. Use hand sanitizer if a sink's not available. And if you have any symptoms consistent with COVID, stay home. Exactly with what Dr. Rose was saying, in order to prevent the spread and slow down the spread. One other item that I wanted to share is many times we are in our society used to minimizing when we are not feeling well, or many times I've heard, well, it was just a handshake or just a hug. We were just together for a few seconds. That close contact, we have seen people have positive COVID test results because of those types of close contacts. And so we ask for you to really use those everyday preventative actions to slow the spread of COVID-19 in our area.
I agree. And you know what Beth said, everything that's being done in school is really working. And so, you know, all three of us have kids in our district. You know, this is really important for us to get these kids back in school because I think that's where they learn the best. We just don't yet have the data that backs up the safety of having kids in school when the community spread is this high. Now, we do hear that the Harvard model with the metrics for school is being updated, and that's really exciting. And you know, if we can hear more data on that and follow it, then that's key. I think, like Beth was saying, prevention is key. You know, and prevention is hard because you don't see what you're preventing, and yet we are here to learn from history. We can see what happens when communities get overwhelmed by the spread of COVID. And we forever have talked about flattening the curve. You know, that's more important now than ever. The purpose of flattening the curve is so that health centers don't get overwhelmed. And we're getting to that point. You know, people talk about, well, the death rate isn't that high of this virus. That will change if our numbers get too high, our hospital admissions and ICU beds get higher in numbers, the death rate will change because we can't keep up with it all when communities get saturated. So I want to echo, you know, keep kids home even if they're mildly sick. I know it's hard, but if we're in person, that's how we stay in person. Be creative regarding social outings, you know, grocery shopping, ordering food for curbside pickup, support those local businesses, but be creative about it. I think about this germ spreading a little bit like smoke. And so if you think about sitting in a room with 4, 5, 6 people, none of which have masks on, and somebody is COVID positive, that concentration of germ starts filling up the air, kind of like smoke might. Now, if 1 or 2 or 3 and the person who has COVID has a mask on, that greatly decreases. If that room is bigger and people are more spread apart, it greatly decreases the concentration. If there's a bit of a breeze, you know, some ventilation, that helps move that out. So if you're in a situation where you feel like, boy, smoke would really accumulate in this area, think the same about the germ. You know, put a mask on. It's not that hard. It's evidence-based, scientifically proven to reduce the spread of COVID. And it's not difficult to do. You know, I think we have several things that we can do, and these next several months are going to be really important to do them in order to keep our kids in school or get our kids back in school and to really reduce the death rate of this germ.
You know, and we, you know, Rose and Beth, we've seen that, you know, when we look back to October when we were in school and we had athletic events going on, our community stepped up so much as far as not congregating at the football game and coming to that. You know, they took our advice and they watched it on live stream. So I know West Salem can do it. And, you know, we know how much our community values education in our school district. And I can't thank them enough for stepping up. And this is one of these times that we're really wanting everybody to step up, because just like what you said, Rose, all three of us have kids in our school, and we want our kids back in school just as much as anybody else. And as parents, we know what a burden is on our families with and everything that we need to do when our kids aren't in school. And so really having that cooperation from everybody right now is so key. And I know that we can do it because we've shown in the past that we're able to do it. And, this is another one of those times that, I'm hoping that we continue to step up like we always have in the past.
I agree. I think this is the time to really step it up. Looking at those curves, we prevented something from March to August. We had cases, but we prevented a huge spread. We're having a really hard time contact tracing. And when that starts falling through the cracks, then it spreads even worse because the counties all over the state. I heard counties on Friday even not using the phrase contact tracing anymore because they're not tracing contacts. They're just trying to get a hold of positive cases. When that stuff stops happening, people don't know they're spreading it. Case numbers go up, hospitals get saturated, and that's what we're trying to prevent.
And, just to second that, and then I'll turn it over to Beth here before I conclude, but, our staff and our students have been doing a tremendous job within our school, following our safety measures and procedures. And, a huge kudos to our staff and our students for doing, not what's the most popular or the most trendy, but doing what they're supposed to do within our buildings with the parameters that we've set. And, I agree. It might not be the most convenient thing to be wearing a mask whenever you're trying to talk to somebody. It might be looked at as an inconvenience, but I can't share enough how proud I am of our students and our staff when they're in our buildings for doing what they're supposed to do. And that's why we've been so successful, Beth.
I completely agree. I give lots of kudos. We would not be successful without our students and staff following these protocols. They have not had any, we've not had any struggles with that, and I'm very proud of them as well. And I also just want to remember people to be a leader in your circle. Talk to your friends and family about the importance of these safety precautions. And if you have previously resisted taking these precautions, now is the time. You have a chance to change your behavior and to help our community out to slow down the spread of COVID.
Dr. Wolbrink, do you have anything else that you'd like to share?
Just that we can do this. Just every step. Right now, the county shows that about 40% of this is spread in the community. The others are mostly close contacts, which are harder to control, but 40% of the community, that means if we can just reduce some of the community spread, the gatherings, the shopping, that can really start helping.
And then as we conclude here, just a little reminders of our options that we have in our district. We're starting to near that semester time. Anytime you get around this holiday season, semester is not too far away. And, December 1st is especially a lot closer. And the reason why I say December 1st is that we're going to have our second semester registration for our Cooley Region Virtual Academy, or CRVA. That's going to open up on December 1st. And I just can't reiterate how important that is. If you feel like you want to have a steady option for your child and go completely virtual, that's the option for you. And it's important for us as a school district that if that's what you want, then you register for that during that time, because our decisions for staffing and everything for the second semester, so when we get our kids back, we can keep our kids back, to make sure that if we need to minimize class sizes or things like that, that we're able to do that. And so that's why that registration is so important. And I just want to again say, as we come up on this holiday season, make sure that you do spend some time with your family, but family gatherings, they might look a little bit different this year. And I know how difficult that's going to be. But, just be safe. I think what all three of us can echo is we're not trying to tell you what to do. We want you and our community and our kids to be safe. And so, please make sure that you take care of yourself. And as you can see over my left shoulder here, I've got a sign that says, "You've got this," but in reality, West Salem, we've got this. And in order for us to get through this and get our students back in school, and keep our community safe, and so we can go out and enjoy our small businesses throughout our whole entire community, we need to pull together right now so we can help to flatten the curve here, as they say, and get our kids back and start to control this a little bit as much as we can. All right. So with that, everybody, West Salem, thank you so very much for everything that you've done. Thank you for your continued support, and we will talk to you again soon. Thank you so much.